All right, Mario, thank you so much. We're back now with more of our Day of Giving Telethon special. Joining me now is Dr. Rishi Lulla. He is the Chief of Pediatric Hematology Oncology at Hasbro Children. Thanks so much for being here, Dr. Lulla. We're so happy to have you.
Thank you so much for having us.
Of course. And so tell me a little bit about your role.
Yeah.
What's your everyday job look like?
Yeah, well, so I am the Division Director of Pediatric Hematology Oncology at Hasbro. I have the privilege of leading our team of just incredible caregivers that care for children and young adults diagnosed with cancer and other rare blood disorders. It's truly a privilege to do the work that we do to support the patients in our community.
You're doing extremely important work at that. We've heard some amazing stories so far today.
Yeah.
Are there any stories that really stand out to you in your work?
Well, over the course of the day today, we've heard some incredible stories from some of our patients and families, and some of the things that are really important to us is how we can support patients and families to keep them here at home in Rhode Island. You've heard today about wonderful stories of communities that are built when you least expect them. Kids who find each other in the clinic or in the hospital and become lifelong friends. And you've heard about some of the importance of the wonderful multidisciplinary care teams that we put together to support our patients and families.
I know we can't tell the future, but if we could, what does the future of pediatric cancer care in Rhode Island, in the Ocean State, look like?
Yeah, I appreciate you asking that. I would say the future for us is really bright. As I mentioned, we have an incredible team of folks. We have the wonderful support of Hasbro. And what we're really able to do is provide our patients right here at home in Rhode Island with the very best care for their types of cancer. Every single child who enters our door is given the opportunity to participate on a clinical trial to help us better understand their tumor or cancer and learn how to treat it in the best possible way. And this really, to me, represents sort of the cutting edge of where we need to be in supporting kids and their families with cancer.
We really appreciate your work. One last question for
Yeah.
you is, what do you do to, stay positive? You have a really tough job.
I would say this, our job is tough many days of the week, and there are a lot of victories too. So we celebrate the victories, we recognize the tough days, and pretty much like most of us, we feel really privileged to work with a great team and in a great environment so that even those tough days can be made a little bit easier.
Dr. Lulla, thank you so much. We appreciate you being here.
Thanks for the opportunity.